Prediabetes can still be reversed if detected early. If you often feel tired for no reason or experience constant thirst and hunger even after eating, these may be signals that your body is trying to communicate something important. Today, we'll discuss a condition that could be affecting millions of people without their knowledge: prediabetes. Yes, it can be stealthy, but we're here to help you identify the 14 early signs that may indicate your blood sugar is higher than normal. We'll also provide key steps to prevent diabetes, as prediabetes is a condition that can be reversed. So stay tuned and let's dive into the details. Sign 1. Frequent urination. In individuals with prediabetes, insulin resistance prevents cells from properly absorbing glucose from the bloodstream, leading to elevated blood glucose levels. Our kidneys have a limited ability to reabsorb this glucose, so they excrete some of it through urine. The glucose in the urine creates an osmotic effect, drawing water into the renal tubules, making it harder for the kidneys to reabsorb water, resulting in an increase in urine output. This leads to more frequent urination, directly connecting to the next sign on our list. Sign 2. Dry mouth and excessive thirst. Frequent urination throughout the day results in more water being excreted through urine, which can cause dehydration. Our body has smart mechanisms to detect this water loss, triggering a sensation of thirst, signaling that we need to drink more to replace lost fluids. Additionally, dehydration can reduce saliva production, causing dry mouth. If you're drinking the recommended amount of water but still feel excessively thirsty, consult your doctor to take preventative steps against diabetes. Sign 3. Excessive hunger. In prediabetes, the body cells struggle to respond properly to insulin, the hormone responsible for transporting glucose into cells for energy. This difficulty in using glucose as energy can create a constant feeling of hunger, as the body tries to compensate for the energy deficit. Insulin resistance may also disrupt hormones like leptin and ghrelin, which control appetite, resulting in hunger even after meals. Sign 4. Slow healing. This sign often goes unnoticed, as it's not every day we have a wound to monitor its healing. In those with prediabetes, high blood sugar levels can damage blood vessels and reduce blood flow to injured areas, causing poor circulation. This inadequate supply of nutrients and oxygen delays wound healing. Prediabetes can also compromise the immune system, making it less effective against infections around the wound, leading to slower healing. Sign 5. Fatigue. Due to insulin resistance, cells may not receive enough glucose to produce energy, causing fatigue and weakness since cells lack the fuel they need. Additionally, insulin resistance can lead to hormonal imbalances, including changes in cortisol and other stress-related hormones, which may contribute to fatigue. Those with prediabetes may also be more prone to sleep disorders, like sleep apnea, which disrupts sleep quality and can lead to fatigue during the day. Chronic inflammation, often present in prediabetic individuals, is another factor that can contribute to fatigue. Sign 6. Blurred vision. High blood glucose levels can change the shape and function of the eye's lens, making it temporarily less flexible, which may impair clear and sharp focus, causing blurred vision. In some cases, chronic hyperglycemia can lead to fluid buildup in the central area of the retina, known as diabetic macular edema, which can result in blurry or distorted vision. High blood sugar can also damage the small blood vessels that nourish the eyes, affecting circulation and vision. Those with prediabetes are at greater risk of developing other eye conditions, like cataracts and glaucoma, which can also contribute to blurred vision. Sign 7. Frequent infections. Prediabetes can weaken the immune system, making it less effective in fighting bacterial, viral, and fungal infections, which may result in a higher frequency of infections. The gums are commonly affected, as high blood glucose levels can increase glucose in saliva, creating an environment favorable to bacterial growth in the mouth, leading to gum infections. These infections may take longer to improve due to poor circulation associated with prediabetes, which reduces the transport of immune cells to infected areas. Excess glucose in urine can also create a favorable environment for urinary tract infections. Sign 8. Tingling and numbness in extremity. Chronic hyperglycemia can damage small blood vessels and peripheral nerves responsible for sensation and movement in the limbs. When peripheral nerves are damaged, a person may experience decreased or lost sensation, causing tingling, numbness, and burning sensations. Nerve damage can also lead to neuropathic pain, characterized by burning, stabbing, or electric shock sensations in the affected limbs. Some people report a burning feeling in their feet when lying down at night. Sign 9. Difficulty concentrating. In prediabetes, insulin resistance may cause blood glucose fluctuations. When glucose levels are too high or too low, this can affect brain function and reduce concentration. High glucose levels can damage blood vessels that supply the brain, impairing cerebral blood flow and potentially affecting cognitive function. As we've seen, high blood glucose can also cause fatigue and general discomfort, further hindering concentration and affecting performance on tasks requiring focus. Sign 10. Unexplained weight loss. In a prediabetic state, the body becomes inefficient at using glucose as an energy source, breaking down fat and protein reserves for energy, leading to weight loss. As the body excretes more urine, dehydration can also lead to weight loss. Unexplained weight changes should be monitored, as they can indicate the development of prediabetes. Sign 11. Erectile dysfunction. Insulin resistance and hyperglycemia can negatively impact blood flow to the penis, making it difficult to achieve satisfactory erections. Over time, prediabetes can damage nerves and blood vessels, interfering with the neural response and blood flow necessary for erection. Sign 12. Irritability. Insulin resistance and hormonal imbalances associated with prediabetes can affect serotonin and dopamine levels, impacting mood regulation and leading to mood swings, including irritability. Constant blood glucose fluctuations can also influence mood, as can the sleep disturbances common in prediabetic individuals. Sign 13. Dry, itchy skin. In prediabetes, increased water excretion by the kidneys can lead to dehydration, which can dry out the skin. Poor circulation is also linked to dry skin, as it reduces nutrient and water supply to the skin. Elevated blood glucose levels can also damage nerves, impacting sweat gland function, which reduces natural oil production, leading to dry, itchy skin. Sign 14. Excess abdominal fat. In prediabetes, body cells don't respond well to insulin. The pancreas compensates by producing more insulin, which can promote abdominal fat storage. Chronic inflammation due to a sedentary lifestyle and a diet high in calories and refined carbohydrates is another factor. Tips to prevent diabetes. Healthy eating is fundamental in preventing diabetes. Incorporate a balanced diet with vegetables, whole grains, lean proteins, healthy fats, and low glycemic fruits. Regular physical activity is also essential. Aim for at least 150 minutes of moderate exercise per week. Avoid smoking and alcohol, manage stress with meditation or other relaxation techniques, and ensure restful sleep. Regular glucose monitoring and blood tests are crucial. Support from friends and family can help you stay motivated. Share your experience. What prediabetes signs were you already aware of? Share them in the comments. Don't forget to share this video with friends and family, so they can recognize these crucial signs too. If you enjoyed this presentation, subscribe for more health content. Thank you for watching and see you next time.